am Dr. Vijayakumar Narayanan. I did my basic medical graduation from Kerala, South India. And we have a lot of evidence to suggest or state that a preserved breast or breast conserved patient will have more survival than a mastectomy patient. So once you diagnose with the breast cancer, the old dictum of the treatment, go for a removal of the breast, is not like, it is not no more. It is obsolete. Now we are trying to preserve the breast. It's called breast conservation surgery. If the patient can afford, the radiotherapy post-operatively, we always prefer to go for breast preservation surgery, if it is possible. But in some occasions, we may not be able to preserve it. Suppose the tumor has extended onto the skin, ulcerated, multifocal, very small breast where there is no room for a preservation and all, then we usually go for a mastectomy. So this is, so first thing is diagnosis, then staging workup, then plan the treatment based on the stages. So whenever, if the patient is coming to me, I always promote the patient. I tell my patient, this is my opinion. You can have second opinion. You can have third opinion. You can have fourth opinion. It's all up to you. But don't Google it and then finalize your treatment. That is because you don't challenge your my clinical knowledge of 20 years with your Google knowledge. That I know I will not agree with them. But you can have first or second or third opinion. In usually what we do in our center, like this thing, or higher centers and all, we always put up this each and every cancer cases for tumor board discussion. Tumor board is a multidisciplinary board. We have radiation oncologist, medical oncologist, surgical oncologist, then pathologist, radiologist. They all sit together. We present a case and then we discuss it and we arrive at a consensus. This is called tumor board discussion and finalizing the treatment. But we have accepted guidelines for managing different stages of the treatment. Some of the most of the occasions we may not be able to simply absorb the guidelines that is given by the European or the Western population, because our system is different, our culture is different, our priorities are different, our financial capability is different. So we have to tailor a treatment that is suiting to that particular patient. So we will usually do a tumor board discussion and then we will finalize the treatment. That is how we manage the breast cancer. The treatment are usually chemotherapy, surgery, radiotherapy, and supportive treatment. Now coming to the question of whether men can have breast. Yes, breast is there for men also, right? So anybody who has a breast can have breast cancer. So men also can, but that's very rare. 1% only we have seen among the breast cancer cases. Only 1% or even less than that is a men breast cancer. But if the breast cancer happens in a man, it will be more aggressive than a woman. About the age whom we can have the breast cancer, I should say that I have seen women with breast cancer even at the age of 25, even lesser than that. Usually it's a tumor of the post-menopausal women. Here the question arises, you see, why this many cancers are coming in our community or our society nowadays? It is because the most important risk factor for cancer is aging. When your aging population is on the increase, then you can expect a corresponding increase in the cancer incidence as well. So aging is considered as most important risk factor of the cancer. Similarly, in breast cancer also, mostly the breast cancer happens in post-menopausal women. Thank you for joining with me for this discussion on cancer, especially the breast cancer and prostate cancer. I'm an oncologist and you can book my services through ponea.com, and ponea.com is a wonderful service provider for different specialties of medicine, and you can access my oncology services through ponea.com. Thank you very much.